Hi, Dr. Butler here. Thanks so much for taking the time to learn more about your health today. Wanted to speak with you about a topic that I've been thinking about just as it relates to your health and these concepts that we start thinking about when we're treating people who have chronic illnesses or people who are dealing with even acute health concerns, but predominantly chronic health concerns. And I'm just actually in a break between patients here and felt the need to relay the information that I was thinking about, because I think it's very helpful for you, the individual, when you're making choices about your health care and the way that you think about your health care, and giving you, again, knowledge to empower you on your healthcare journey, essentially. So this has to do with how we treat people and the expectations that patients have from practitioners, the expectations practitioners have from patients as we work to identify and treat the cause of health concerns. And I'm just reminded daily when I see my patients on the fact that health is so much more than the symptom that the individual is dealing with. We've entirely overemphasized that concept in our healthcare model, in all aspects of healthcare, not just the conventional side of things, but even in the alternative or naturopathic or holistic side of things. There definitely are practitioners who are pushing the boundaries of moving past symptoms and dealing with true causation, but causation is solely on the individual and their experience in the life that they are living as it pertains to their choices, and those choices that impact them directly with their health. The unfortunate part is that sometimes in people's lives, choices are made for them, whether that's from a familial standpoint, whether that's from a cultural standpoint, and those choices, unfortunately, can be very impactful on an individual's health. And be life altering or again body altering or mind altering, that really sets an individual up for having to manage for a period of time or for the rest of their life the impact of the environment on their health and the subsequent symptoms that will follow, whether that is blood pressure or anxiety, depression, or diseases like cancer or diabetes. We have to be, or I have to be, really aware of this, because as I explain it to my patients, is that you have the power to heal yourself, to improve your level of health, and your doctor is not there to fix it for you. They are not there to give you the magic bullet, the drug, the herb to make it better. A doctor is not there to heal you. You are there to heal you. Your doctor is there, and you're not just a doctor, but your support team, your health care team, people around you who are encouraging you, are there to give you the support, the education, the information, so you can start applying principles to your everyday choice that are working to help your body and mind move back to a place of homeostasis. We are so caught up in a way of thinking around our health care that pertains to the concept of, can't you just give me something to make that better? And it is removing us from our own awareness of the power that we have based upon, as I mentioned, our choice, your choice, your belief, the environment that you choose to put yourself in. All of that is so much more significant than the medicine, than the herb, than the pill. The drugs, the herbs, the other things, they buy time. And some of them buy time by robbing Peter to pay Paul. Unfortunately, pharmaceutical drugs and potentized chemical agents create some fast change, but you're robbing another part of the body to get that effect, and that's not a good long-term sustainable goal. If needed for short periods of time, it can be utilized, but we don't like that as a primary treatment option. We like buying time with things like herbs and homeopathy and other botanical medicines and supplements and nutrients, and but they are there to improve function long enough for the individual to make a change in their present environment, that the body can start adapting back to a place of homeostasis. And sometimes people are unaware of even where that is. What does that even look like? They're just hurting so much right now that they need relief, and they need a moment to be able to breathe and have reprieve from their symptoms. And there is individualized times where that is appropriate, but it is overdone, it is overemphasized, it is it is held at the pinnacle of this concept of healthcare, and it's not. It is not focused from a standpoint of giving the body the tools that it needs, removing the obstacles that are presented in the system that's preventing health and healing from happening. You have to know that your day in and day out choice, and I keep reiterating this because it's so important, but your day in and day out choice of what you choose to put into your body, what you choose to believe, how you choose to relate to your physical environment through movement, through breathing, through hydration, through routine, are foundational in the prevention and treatment of illness. Illness is part of life. We will never find the cure against chronic illnesses, acute illnesses, and bacterias and viruses and things that make us acutely sick that obviously can lead towards mortality. We've done a pretty good job thus far at eradicating some of that, even though I believe we've been trading acute illness for chronic disease. But the chronic illnesses that people are suffering for are the bigger issue right now that's consuming our healthcare resources. And the thing to remember is that the body is never wrong. Your body adapts and it changes and it creates symptoms and it creates feedback because it is what is needed. That you are a spiritual being, but the organism part of you is adapting in an effort to sustain within the environment that it is functioning in. So when you get a symptom, when you get feedback that is of benefit to the organism's state of function, we should be working not to shut that down. We should be working to understand why that is happening and encouraging the individual to use that information to guide them and help them start exploring the concept of cause and effect. We do a disservice to our patients when we just give them something that makes that symptom go away or makes that symptom appear to be an unimportant aspect of their life and health, because what's going on behind it is still happening. Just because you're treating the symptom does not mean that it's changing the environment of what's going on behind it. That's contributing to the eventual presentation of that symptomatic response. It's just obviously it's so convenient. It's fairly easy on the patient's behalf to focus on that symptom, to just have the authority of the doctor, of the healthcare practitioner to write the prescription, to prescribe the medicine. The patient takes it and then they're better and they're on their way. but this reoccurrence and this morphing of symptomology into a new presentation, one that becomes harder to address, harder to treat, more resources have to go into that, is, again, I'm feeling slightly, how should I put it? It's a little absurd that we're continuing to work at that level of thinking. And the old cliche concept of a paradigm shift, right? I call it cliche because I've heard it a lot, but you might not have heard that concept before. But it's, how do we look at this differently? How do we think about this differently? We've been doing that in so many parts of our lives, I feel like, with the advances of different technological ideas and the advances of, which I'm not necessarily entirely all for on certain circumstances, but we seem to be evolving in our level of thinking in many different areas in our culture and our world, but we tend to be holding pretty firm to the same level of thinking when it comes to healthcare and when it comes to educating our patients on causation and the authorities. As naturopaths, I like to say we're the low folks on the totem pole. We don't get a lot of credibility. We don't get a lot of, I would say, respect for, who we are and what we do, and I'm okay with that. I know that at least for what I'm telling you, I'm speaking the truth of this concept of cause and effect, and unfortunately the authority is not giving that information to the patient. They're not helping you understand the role that you have, the role that you play within your own healthcare, and I'm encouraging you to be forward with that. Start asking questions. Start asking, why are things happening? And if you're not getting the answers from those in your team, then find another team or go start self-educating. Know that there's so much power in the decisions that you make on a day-to-day basis that it can have huge ramifications on the direction of where your health is going. And I see that every day too. I see my patients who apply that, and the huge benefit and the self-awareness, this almost awakening that the individual has to an understanding of the control that they pose in regards to their own health and the symptoms that present and this excitement that occurs, because they're not perfect though. They make choices that what I term is, in my bucket analogy, it fills back up their bucket, but they're starting to get clearer and clearer with a knowing why things happen. When you know why something is occurring, then you are in charge of it. You get the opportunity to start having a different relationship with your body, with your mind, with your health, and there's, again, a lot of healing that can happen within that direction of healthcare, not the direction of just giving another supplement, giving another prescription medication, giving another herb. Those, again, some of those tools are wonderful and they help, and like I said, they buy time and they improve how you feel, but you have to utilize that opportunity of when you start feeling better to accelerate into the awareness of self-care and the exploration of the concept that we call cause and effect. Why? How does this pertain to this? The relationships with your choice and the influence that plays on your health. So I really appreciate you taking the time to watch the video, learn more about your health. I just felt the need to kind of bring that information forward, and I encourage you to keep working your plan. Again, thank you so much for taking the time to learn more about your health today.